Thank you for joining us again this week for our COVID-19 update. I am here today with Bonny Specker, who is going to be giving us an update of what has been happening with COVID-19 in our area, in the state, in the world, and in the United States. And also, we have a special guest today, Beth Fishback, who is the Executive Director of Brookings Behavioral Health and Wellness. Welcome, Beth. Give us a little bit of an idea of your background with mental health.
Sure. Thanks so much for having me. Again, my name is Beth Fishback. I'm the Executive Director of Brookings Behavioral Health and Wellness. I've got graduate degrees in Physician Assistant Studies and Public Health, and have spent most, if not all, of my career actually working in mental health care, either in an inpatient or outpatient setting. I've been with Brookings Behavioral Health and Wellness for a number of years now, and have just been actively involved in mental health services or mental health advocacy, again, for most of my career.
Well, we are happy that you are here to speak to us about mental health today and the impact from COVID-19. Can you share with us what you're going to be talking about today?
Yes, absolutely. So I'm going to give us a brief background on some of our most common mental health challenges that we see under normal circumstances. And then we're going to look at the impact that COVID-19 has had on mental health and just our general health as a city and as a population. So as I start my presentation today, I want to just take a minute and give a couple of definitions so that we can all be on the same page with terms and how we talk about mental health or mental illness. Typically when we talk about mental health or addiction or behavioral health, there's so many terms that are frequently used somewhat interchangeably, but don't always necessarily mean the same thing. So I like to just get us centered on some common definitions and help make sure that we're all on the same page as we get started here. So the first one is mental health. And this is something that we all have. We all have mental health. It is your emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also, our mental health determines how we handle stress. It's how we relate to others. It's how we make healthy choices. And there's certainly a continuum of mental health, right? There are times when we feel more mentally healthy or mentally strong than others. And all of those times really impact then how we think, feel, act, and make healthy choices. So mental health, again, is something that we all have and something that we should all be striving for. Any mental illness, or AMI, is a mental, behavioral, or emotional disorder. It can vary in impact and range from no impairment at all to mild, moderate, and even severe impairment. Typically, when we think of any mental illness, the most common ones that come to mind are going to be like an anxiety or a depression, where it is a diagnosed condition, but it again varies in impairment. A serious mental illness, or SMI, is again a mental, behavioral, or emotional disorder, but this time it really results in a serious functional impairment, and that impairment is going to substantially interfere with or limit a major life activity. Some diagnoses that would typically fall into a serious mental illness would be like bipolar disorder, schizophrenia. Again, those disorders that are going to have some significant impact in daily functioning. And then behavioral health is a term that generally encompasses both mental health and substance use disorders, but it also covers prevention, intervention, treatment, and early recovery support services. And again, behavioral health really looks at our behaviors and how those impact someone's physical and mental health. So kind of four key definitions there that hopefully will guide some of the discussion as we move along here. Okay, now we will just talk some basic statistics here. I've got nationwide prevalence data. 1 in 5 adults in the US lives with a mental illness. That's about 51.5 million individuals. Mental illness really can affect anyone, regardless of age, gender, race, or socioeconomic status. It affects anyone at any given time. 43.8% of individuals received mental health services in the past year. And so that would be, of the individuals living with mental illness, how many of them received services? So about half of the individuals experiencing a mental illness will receive services. And then approximately 10.2 million adults have a co-occurring mental health and addiction disorder. So that just means they're experiencing symptoms of a mental illness as well as a substance use disorder at the same time. Suicide is currently the 10th leading cause of death in the United States, and that really elevates as we look at the younger population. It's the second leading cause of death for people aged 10 to 34. And then 90% of those who die by suicide have an underlying mental illness. For the financial impact, mental illness costs the US $193.2 billion in lost earnings every year. Now, if we drill down specifically to some prevalence numbers that are stemming from the COVID-19 pandemic, the CDC put out a web-based survey that was looking at individuals' reports of mental health, substance use, and suicidal ideation during the pandemic from the time period of April to June in 2020. So it's a pretty short time frame, limited respondents, but still some pretty interesting data that we were able to get from that. 40% of US adults reported that they struggle with a mental health or substance use symptom, again, in that survey period from April to June. 13% of adults completing the survey reported that they started or increased their use of substances during that time. More than half of the respondents age 18 to 55 experienced at least one adverse mental or behavioral health symptom. And then we did see some elevated suicidal ideation responses as well, about 2 times the reports of serious consideration of suicide, again, during that April to June timeframe. When we look specifically at essential workers and unpaid caregivers of adults, we see, again, some increased numbers there, with 54% of essential workers and 66% of unpaid caregivers that are experiencing at least one adverse mental or behavioral health symptom. In the next couple of slides, we'll talk through what some of those symptoms are, so it gives you a little bit more context there as well. The most common mental health concerns that are being reported relate to symptoms of anxiety and depression. So we're going to talk in more detail about those, but we're also going to talk about grief and loss, which are experienced for a variety of different reasons and are certainly amplified during a pandemic. We're also going to talk about our stress response and how that can impact our mental and physical health. So looking specifically at anxiety, again, anxiety disorders are among the most common mental illness diagnoses in the US, certainly seeing heightened levels of these during the pandemic as well. And then there's different types of anxiety disorders that fall under the anxiety category. So we're going to kind of talk about all of them together, but generalized anxiety, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and then social anxiety disorder. A lot of the symptoms look very similar. There are some differences, of course, but we really look at severity of symptoms and then impairment of functioning as well. Some common symptoms of anxiety are going to be feelings of stress and apprehension, irritability, trouble concentrating, fearfulness, sweating and dizziness, shortness of breath, irregular heartbeat, muscle pain and tension, headaches, and then frequent upset stomach or diarrhea. You'll notice that a lot of these symptoms are very much physical in nature. Individuals that are experiencing anxiety or anxiety symptoms for the first time, sometimes even more severe panic attack type symptoms, will show up at the emergency department or show up to their doctor complaining of these physical symptoms or feeling like they're having a heart attack even. If you look at a lot of these symptoms, they are very similar to what someone would experience when they're having a heart attack, but they will show up to a medical provider with these symptoms and not knowing where it's coming from. So something to keep in mind, as we talk about just the general effects of um, mental health conditions, a lot of them have physical symptoms that we experience. And so making sure that we're really staying in tune with ourselves and looking out for the people around us to identify when those symptoms might actually be something that's more mental health related as opposed to simply a physical symptom. Depression, I categorize it into kind of three major areas of symptoms. So we've got your physical well-being, your emotional symptoms, and then your thinking symptoms. The physical well-being symptoms, changes in sleep and appetite, and then somatic complaints with no identifiable source. Everyone experiences these symptoms a little bit differently. So changes in sleep and appetite can go either direction. You can have someone who's maybe experiencing more insomnia, and then someone who's experiencing the complete opposite, where they will sleep, 18, 20 hours a day. So sleeping too much versus sleeping too little. Same on the appetite or food intake side, eating too much or eating too little. It's going to be very kind of dependent on the individual. And then somatic complaints with no identifiable source. That is, again, looking at those physical symptoms. So where an individual would show up to their medical provider, a lot of times complaining of pain. We see a lot of complaints of back pain, shoulder, neck pain, headaches. So pain of some sort, and then GI effects are really the other kind of major somatic complaint that we see. So nausea, vomiting, diarrhea, constipation, those all can be examples of somatic complaints where it feels like a physical symptom, but in actuality, it's really related to a depression type symptom. Our emotion symptoms, sadness, feelings of being overwhelmed, feelings of hopelessness, and feelings of powerlessness. This I think is interesting because as I look at these emotional symptoms, I think about how I have felt over the last year with the COVID-19 pandemic. And a lot of these things I've experienced throughout the year, that feeling of powerlessness. We're in a global pandemic. We don't have the ability to control really its outcome. It's very overwhelming. The thought of working from home, taking care of kids remotely, all of those feelings that are kind of depression symptoms are something that myself and probably a lot of us have felt maybe multiple times throughout the last year experiencing a pandemic. So we'll talk a little bit more about when we start to worry about those symptoms, if they're dragging on for a period of time, or how we can help either ourselves or our loved ones better manage those symptoms when we experience them. Some of the thinking symptoms then, seeing a glass as half empty, having trouble concentrating or paying attention, and then that resulting in difficulty reading or completing tasks at work. Now I want to touch on some grief and loss items here. Grief is a normal response to loss, especially during a disaster or traumatic event, but I want everyone to remember that grief is not simply limited to loss of life. I think that's what we commonly associate it with, but it can also be felt following any type of drastic change to our daily routines or ways of life that usually bring us comfort and stability. So again, if we think about the last year and what the COVID-19 has done to all of our daily lives, we have had drastic changes in our daily lives, in our daily routines, in our stability that we find around us. So it's not uncommon for people to experience grief related to those changes. And particularly during a pandemic, it's not uncommon for people to experience multiple types of losses and then the grief associated with those losses. So for example, you might not be able to be with loved ones. You might not be able to mourn the death of a loved one in person. You might have experienced loss of job, so unemployment, loss of income. There's a loss or reduction in support services, changes in lifestyle, For our college kids or our school-aged kids, loss of social activities, normal sporting events. So there's any number of things that individuals in our community might be experiencing as a loss and have some sort of grief response related to that loss. So common grief-related reactions are going to be shock, disbelief or denial, anxiety, distress, anger, periods of sadness, and then loss of sleep or loss of appetite. One of the challenges I think that we face with grief is when some of these common grief reactions actually evolve into what could be considered a diagnosed mental illness, such as major depression or generalized anxiety disorder. So typically we will look at the severity of symptoms and their duration when we're making an assessment as to whether grief has moved into a different diagnostic category. Right now, when we're in the middle of a global pandemic, we're just about a year in from when I think we had some major impacts starting to be felt here in Brookings. That's a year of our lives that we've had some major disruptions due to this pandemic, and well beyond what we would typically think of as a normal grief response timeframe, right? So when we would be typically looking at individuals transitioning from a grief response to something like a depressive episode or a generalized anxiety, but we're still living in the pandemic. So that I think becomes a little bit of a challenge of, how do we categorize these things? I think the bottom line here is that we focus on how to help ourselves and how to help the people around us manage the symptoms of grief and loss, of anxiety, of depression, instead of being so concerned about the title of it. But how do we manage the symptoms associated and keep each other strong and healthy and build a resilient community? Stress is another major symptom, major side effect, I guess you could say, of a global pandemic. And it has serious effects on our physical and our mental health. As we've discussed, the pandemic itself has had major effects on our lives. We are facing challenges that we've not faced before. And a lot of our important public health measures that are really necessary to keeping us safe and helping us to reduce the spread of COVID-19, things like social distancing, it's necessary and it's important, but it can also make us feel lonely and make us feel a little bit isolated. We're doing things via Zoom instead of in person. So some of that can also increase our feelings of stress, our feelings of anxiety. And again, some of those have some serious impacts on our overall physical and mental health. Some of those effects are going to include fear, anger, sadness, worry, changes in appetite, changes in desires or interests, difficulty concentrating and making decisions, difficulty sleeping. Again, we see a lot of somatic type complaints, so headaches, body pains, stomach pains, worsening of chronic health problems, worsening of mental health problems, and then increased use of substances. So again, as I just mentioned, we see from slide to slide, anxiety, depression, grief, stress, we're seeing a lot of very similar symptoms, very similar effects on our physical and mental health. And I think the key here is not so much to focus on the labeling of those symptoms, but really identify when as individuals or our family members are struggling and how we can help ourselves cope, how we can reach out for help, and really what resources are in our community to help us move through some of those symptoms. So let's talk about some of those ways to cope and some of the resources that we do have in our community. So some healthy ways to cope with stress, or again, any of the feelings that we've experienced or we've talked about so far. One big thing, taking a break from watching, reading, or listening to the news. This, I think early on in the pandemic, I know for myself, I constantly had news on. I was needing to know exactly what was happening around me to sort of give me back some of that control, right? I also noticed that working remotely, being in a different environment, I had the ability to have a radio or television on in the background. And it was always on a news station. So I had kind of 24/7 news input. And just that alone, I think, can increase stress. So taking breaks from that, taking breaks from the news, from social media, just stepping back and unplugging a bit can help us lower our stress levels. And then taking care of our bodies. So things like taking small breaks throughout the day to take deep breaths, do some stretching, kind of meditate or reground yourself, making sure that you're focusing on eating healthy, well-balanced meals, getting regular exercise, getting plenty of sleep, and then avoid excessive alcohol, tobacco, or substances, and maintaining as best as possible those daily routines. And I know, a lot of us are starting to get back to some type of normal routine at this point, but making sure that if you're still working from home, that you're setting clear boundaries between your work day and your home day. I heard that a lot actually at the kind of the start of the pandemic, when people were just getting used to working from home. They were really struggling because their work and home life just completely blurred together. You're working from your kitchen table or sitting in bed in your pajamas still working. And that can be very difficult for people to not have that separation. So making sure that even if you are still at home, you're having a morning routine where you get up and get dressed, and have a designated area for you to do your work. And then a specific time at the end of the day that you're going to stop and kind of go back into your home time so that it doesn't all blur together. But those daily routines are very important. And then making time to just unwind and unplug. It kind of goes back to that taking a break from watching and listening to news. Just turn off your screen, turn off your computer. We're on it so much now that just taking a step back from it can have a huge impact. And then finding ways, either creative ways to connect with others. So you have, social distance gathering of friends or doing a Zoom call or something like that, but finding ways to just stay connected with the people around you. Resources that are available in our community. I think Brookings, we are so fortunate to have a lot of really great resources for healthcare in general, and that's going to include mental health care. The first one up top is our mental health resource guide, is available through 211. This is a downloadable, searchable guide. You can do it right through the website, or you can download a PDF version to share with family, coworkers, etc. But this is all available mental health resources in the Brookings community. And it's something that is supported by our local Brookings area United Way. We're really fortunate to have the United Way support this resource guide so that we're able to have both for-profit and nonprofit entities included in the resource guide. So it gives you a list of all available resources, including independent practitioners. So it's a really great comprehensive guide for mental health support in the community. I encourage everyone to check it out through the 211 website. Also, an easy way to start the conversation is to reach out to your primary care provider. Our primary care providers here in Brookings are fabulous, and just simply reaching out to them and asking for help, explaining what you're feeling. They know how to connect you to additional resources if they don't feel as if they can handle it on their own. So starting with your primary care provider is always a great option. And then, of course, my agency, Brookings Behavioral Health and Wellness, it's our local community mental health center here in Brookings. We provide 24/7, 365 services. We've got emergency crisis care services and a wide variety of mental health and substance use support to anyone in Brookings County that may need assistance. So again, a lot of really great resources here in our Brookings community to support our mental and physical health. And that's all I have for today. My contact information is listed here. Please don't hesitate. If you have questions, concerns, you need a resource, please feel free to reach out either to me directly through my contact information, or you can always find more information at our website for Brookings Behavioral Health and Wellness.
Well, thank you so much for sharing that information. It's great to help people find ways to identify what they might be going through and some of these things that are happening that they may not have even been relating to, like stress or anxiety. It's surprising. So some of those things that you're talking about, they happen when you don't feel well, but ultimately when your mind isn't feeling well, you're not feeling well either. So it's great to be able to help them identify those, and thank you for sharing the resources that are available in the community as well. For those of you that are watching, I have provided links to those resources in the comments section of this video. So just go ahead and click on those, or you can always, as Mary Beth said, call 211 and they can help connect you to the resources that you need. I appreciate your time today, Mary Beth. Thank you so much.
Awesome. Thanks so much for having me. I appreciate it.
Well, I think that was a really awesome presentation that Mary Beth presented to us about mental health. It's just one of those things that it's just something that our community can learn more about, and it's wonderful to have that information there.
Yes, it is.
So what do you have for us today, Bonnie?
Well, before I start, I just want to talk a second about things that have changed a little bit. People may have noticed that the daily updates are not on the city website anymore. And I have switched that to once a week, and I'll be doing it from Wednesday to Wednesday. And Chelsea, you can talk about how that's going to affect this video later, but I wanted to show some of the people the slides that we have in those weekly updates. They give the same information as we normally present during our update. So I thought I would do that. Today, there's a lot of other slides in that weekly update that if people are interested, they should look through it. And as always, if they have any questions or they would like a particular slide to be discussed on this weekly video, let Chelsea know, and I'll be happy to do that. But these are pretty much the summary slides for the county, the state, the US, and the world. In order to do this, what I did is I switched all the data from per day data to per week. So originally we had a figure very similar to this, but it had the number of cases each day. And I've been keeping track of that 7 days a week for over a year, and thought it might be nice sort of back off, so kind of what Mary Beth was talking about just sort of turning your computer off. I wanted to spend a little less time looking at all the COVID numbers. And so I'll be doing this the once a week. So here we have the Brookings numbers, the different ordinances and the timings of those. The total cases as of last Wednesday. So this is not the most recent, but we had to get it to a point where we can start adding. We had 3,542 cases. And for that week, we had 47 per week compared to the week before, which was 55. And those are shown here. So this is 47, 55. You can see, we had our peak back here in the middle of November. We're getting down. This is the substantial spread cutoff. And then there's going to be a moderate spread, that anything below that's minimal. So that's actually going to right around here. But we're getting very close to that moderate spread level, which is nice. One of the other things I just wanted to show people, this is a slide. It's not what I normally give each week for a weekly update, but it does show nicely the age distribution of people in Brookings County that have tested positive over time. So this is 100%. So this is all the people that have had a positive test. And you can see early on, it was a lot of the 20 to 29-year-old age group, but this has changed. And you see that in probably the last couple of months, the biggest increases are actually in this 30 to 49-year age group. You know, that's where we've been seeing quite a few. These data the Department of Health are nice enough to provide us with every Wednesday, so we will be updating that on a weekly basis. These are the number of hospitalizations per week in Brookings County. I have a note on here that the data after February 10th are incomplete. Again, this slide is as of February 17th, but the Department of Health dashboard has a lag period, and for hospitalizations, that lag is about 10 days, so that they can't guarantee that all the hospitalizations have been reported. For Brookings County, there have been 122 hospitalizations. There were 1 the week ending February 17th and 2 for the week ending February 10th. Total deaths, 35 as of February 17th, and there had not been a death the previous week compared to 1 the week before that. Vaccination data, a lot of people are interested in what percent of the county's been vaccinated. And I also have this in the weekly handout for the top 10 counties in terms of population size. And what is important to realize is that this percentage doesn't really, it's simply what percent of the total population has been vaccinated. And it doesn't reflect the percentage of the currently eligible population. So Brookings County actually, as a total percent, is a little bit on the low side, but part of that is because our population is so young. And we have a lot more people in the 20 to 39-year age group than we do in that 70 plus that are eligible to be vaccinated at the time this slide was made. But this is updated every week. And right now, or as of last Wednesday, over 10% of Brookings County residents have received at least 1 vaccine, and close to 16% of the state. If you look at the South Dakota data, these are the case data by week, and there are over 110,000 cases. The case numbers went up a little. The week ending February 17th, there were 1,055 cases. And the week before that, it was 941. So you can see this is going up just a little bit. The state's also getting close to being below substantial spread. If you look at the hospitalization data, I have a similar note here. The hospitalization data is delayed as far as getting posted on the dashboard. As of last Wednesday, there were 94 people hospitalized. 11 of them were in the ICU. And the total hospital admissions as of last Wednesday were close to 6,500 individuals. The hospitalizations did drop a little bit from 76 the week ending February 10th down to 69 the week ending February 17th. So this graph has 2 axes. The number of admissions per week, you look at this side of the graph, as well as the number in the ICU. So you can see that that number has dropped quite a bit. This number over here is the number that's currently hospitalized. And it could all be on the same axis. At one point in time, it was not possible to put it that way. So it's just the way, because we have some bar graphs and then lines, it's a little bit funky. Number of deaths for South Dakota. This is deaths among people who had COVID. There were a total of 844 deaths as of last Wednesday, 29 of them for the week ending the 17th of February and 33 for the week before. So again, another little decline, but you can see we've dropped quite a bit from the peak here at the end of November and early December. As far as the United States, it's also dropping very nicely. We have over 28 million cases. And for the week ending February 17th, we had close to 500,000, 484,000 cases. And the week ending February 10th, we had about 750,000. So it's dropped this much, which is great. And if you look at the number of deaths, we actually have, I think today we went over 500,000 deaths in the United States. And that's going to be a lot on the news in the next couple of days. But for the week ending February 17th, there were almost 17,000 deaths in that 1 week. And for the week ending February 10th, it was 21,000. So 21,000 up here, dropping down to 17. Hopefully this trend will continue. And it should, because as you saw in the previous slide, the number of cases have been dropping. So that should translate to fewer deaths. As far as the global situation in the world, we have over 110 million cases, and here in the week ending February 17th, down here we have about close to 2.2 million cases in a week. The previous week we had close to 3 million cases during the week. So it's starting to drop just like we saw in the US. As far as deaths, there were 2.4 million deaths as of last Wednesday. And for this week, it was close to 65,000 deaths in the week ending February 17th, compared to close to 87,000 deaths in the week ending February 10th. So that's all we have for this week, and I hope that we can get back on to more of a routine here so it's not so far delayed. I mean, this is as of last Wednesday. Next week when we do the video, it'll be more up to date, but had to have one day where it was off.
Yes, as Bonny mentioned, yes, our videos are they look a little bit different this week. Next week we will be providing an update on Thursday. So you can start to look for the videos at the end of the week rather than the beginning of the week, but they will be from that Wednesday to Wednesday time period. And once again, I just wanted to mention that we're no longer doing the daily updates, but you can still look for weekly updates. But if you do want daily updated information, you can still visit the South Dakota Department of Health website to look at that dashboard, because that is updated daily. And also the Brookings Register on their Facebook page has been putting out a daily update. So you can look for that as long as they continue to do that. So there are ways that you can access some of that information as far as the cases by day in our local area, and that is where you find that. I will put those links in the description of this video, so you will have those to go to. And thank you so much, Bonny. Continue to do what you've been doing. We're very grateful for all the updated information that you provide to us every week. So thank you so much.
You're welcome. It's a pleasure.